Thank you, thank you, thank you so very, very much for being connected on tonight to this wonderful town hall of the Mount Zion Baptist Church. I'm Bishop John Walker III, and of course, I want to welcome you, all of you on our platforms on Facebook, those of you on YouTube, If you're on Facebook, I want you to share, share, share. Please share. This is so important tonight to make certain that we get the information necessary to help us navigate through this coronavirus pandemic and the vaccination and getting clarity about that. And so we are very committed to that and have two amazing guests to whom I will introduce in just a moment. I want you to share now. Make certain you share it. Let's get this word out. Our community needs it. And it's so incredibly important that we do. Thank all of you for watching. Thank our full gospel family for joining in around the world. We appreciate you as well. We are incredibly committed to educating our community, to making certain that we have data, we have information that can help us make very intelligent decisions. That's the kind of church Mount Zion is. We want to make certain, regardless of your connection with our ministry or other ministries in our city or around the world, know that it is important that we have clarity. Tonight, we welcome you to this town hall. Let me introduce our guests, and I want to make a few remarks at the beginning, and of course, we'll get into our Q&A session. And I do want to give you an opportunity to ask questions, and there's a way in which you can do that, and our team will be fielding your questions to make sure we get them and we're able to respond. Let me introduce, first of all, our First Lady, Dr. Stephaine Walker. We certainly thank God for her. We know a woman given to health disparities and oversees our health and wellness ministry, and certainly an advocate for the underserved and an advocate for making certain that we are healthy inside and out. And certainly her life speaks to that. Her educational track speaks to that. And we want to welcome our First Lady. We thank God for her. Welcome, Dr. Steph.
Thank you. Thank you. It's great to be on. I couldn't agree with you more, just in terms of our position in the community and making sure that as a beacon of light, we're here, but we're making sure that our people, our community, and our family of churches or what have you really get the information that they need, because right now, more so than ever before, it's critical not that just that you get the information, but that you get the right information. And that's what we're here for tonight.
Yes, indeed. Thank you for that. And of course, we are welcoming and thanking God for this amazing gift to us, Dr. Kimberly Lamar, who is assistant to our state health commissioner, and she is working with disparities and distribution of disparities throughout the state of Tennessee, and making certain that equity happens in all of those areas. And that's where her passion is. And we appreciate her. And Dr. Kimberly Lamar, welcome.
Thank you. Thank you for the invitation to join this most important meeting. And, I want to make sure that, everyone knows that the Tennessee Department of Health, we are striving to ensure equity around vaccine, but also in around how we respond to this pandemic and preparing our community for moving forward beyond that in recovery. And so we're committed to ensuring, again, that all access to care, access to information, access to this vaccine is equitable.
Thank you, Dr. Lamar. So before we get going, let me share, Mount Zion has a very unique positioning in the kingdom, in the church, particularly in the African-American community, to have a pastor who is a bishop in the church and to have a first lady who is a physician. And it is truly a blessing to see faith and medicine played out, which is so critical now, particularly in light of what we're dealing with now around the vaccine and around much of the conversations around the vaccine in our community, and folks are wondering whether or not they should take it or not, et cetera. And I want to just share with you kind of some biblical backdrop, context to really set this up for us tonight. And I really believe the Word of God when it says that our people perish because of a lack of knowledge. The scripture talks about that these things are written for our example. Oftentimes when we read the scripture, we have to know we're getting an example. And we're looking at scripture in context. We have to know, obviously, there were no automobiles back in Jesus's day. There were no hospitals, all of those things. And so we have to be able to understand what ancient text means in modernity. Now, how do those texts live now? We see these things occurring. What was Jesus saying? Because his words were timeless. Scripture speaks of Jesus, and he speaks of himself as the one who was, who is, and is to come. His message, his ministry was crossing generations. It was not only speaking during the era in which he ministered, but he was sending messages to generations that were to come. If we tap into those revelations, we can see some marvelous principles to help our faith understand how Jesus mitigated many of the situations many of us struggle with today, particularly around this vaccine. Let me give you an example of that. In John chapter 9, there's a marvelous story. Get a chance to read it. It begins around verse 6. It's the context of which I want to speak. Briefly, there's a man who is blind. He is blind. He has a condition. It's a medical condition. He cannot see. Well, the Bible says Jesus does something very interesting. In this particular instance, that we know Jesus was omnipotent, has all power. Jesus could simply speak to the man, and he could have gained his sight. He could have blew air. He would have snapped his finger. The man would have gained his sight. Jesus goes to this unorthodox way of bringing about this man's healing. And when you see Jesus doing that, you have to say, what message? What is he saying to us in terms of the methodology and strategy about bringing about healing for a person and even a community? This instance is so unique because Jesus looks at the man and goes down, takes dirt from the earth, spits on it, makes what we would call a mud pie with spit, saliva, and puts it on the man's eyes. It's an interesting story. He takes something from the earth and something from himself, and he simply puts it on the man's eyes, and he tells the man, go wash in the pool of Siloam. Now, we have to say, what is the revelation there? What could Jesus be showing us? Well, it's simple. Think about it for a moment. Jesus could have just spoken, the man would have been healed. He's giving us kind of an example that here is the remedy. The remedy is I'm spitting on mud, I'm taking something from the earth, I'm taking something from me, and I am putting it in the earth. I am literally giving it to you. Now, I can make it available and I can put it on you, but you have to go and access the pool of Siloam, because if you don't go and wash, it won't mean a thing. I really believe that God has given us science. He's anointed people to be able to remedy whatever maladies are in the earth. I believe that every malady, every question on the earth, the answer is there as well. And God has anointed extraordinary people to be able to come up and figure these things out. And I believe that even though they do that, and that is a gift from God, that we then have a responsibility to go and wash in the pool of Siloam. We could have the vaccination, but if we don't take it, then we still sit up and wonder why we haven't seen the healing. It's the same thing about our medicine. God gives us the medicine, but we don't want to take it. And we say, well, I have faith to believe. Well, no, faith needs a corresponding action. Faith without works is dead. So when we think about the vaccine, what's interesting in that text, and you'll discover that many of those who watch this unorthodox way that Jesus brings about healing question this man, question his parents about Jesus' response, about his sins being forgiven, etc. And they begin to question until the mother said, he's of age, he can speak for himself. Ask him what happened. And what the young man says is so profound. I believe it will give a great launching pad to our discussion tonight. They asked him, what happened to you? And the man says, listen, you can debate all day, whether he's a sinner, whether he is of God. You can debate all day his methodology. You can debate the origin of which he has come. All I know is I was blind, and now I see. When I think about this vaccine, we can debate all day long. We can debate all day long about this and about that and about that. But all I know is that 0 people who have taken this vaccine have died. All I know is that nobody has had full-blown, straight out of the box, unmanageable COVID-19 taken this vaccine. All I know is that. And what I'm very cognizant of is that we can debate this back and forth, but we have to look at the fact that the son is saying to his parents and to the crowd, data doesn't lie. You're looking at me now. And it is also important for you to understand tonight, you should know, Mount Zion, that my wife and I would never come and share something with you that we were not willing to try ourselves. And we're in this space today because we both have been fortunate enough and blessed enough to have received the vaccination. And here we are. Got 2 ears, eyes are still in my head, still functioning, everything is fine. So I say that humorously, but I want you to understand something. We never imagined being here, and this is where my questions began. We were in the month of March, around the 3rd or 4th Sunday, we walked out of church. We had a town hall and said we're going virtual. And what many of us thought this would be was a sprint. We had no idea this would be a marathon. And when we thought maybe 3 months, maybe 4 months, and then they kept moving the finish line back, and we realized the world will never be the same. And I remember specifically when there were literally less than 1,000 people who had died of COVID-19. And today, as we do this town hall, over 500,000 people, 500,000 plus lives have succumbed to COVID-19. Ladies and gentlemen, we have to, particularly in our community, when we think about how it has adversely affected our community, it is very necessary that we be responsible and share the appropriate information with our people to make certain that we get the help and resources that we need. To that end, I want to ask you, Dr. Steph, many minorities have justifiable reasons why they're skeptical about this vaccine. Historical realities around Tuskegee, as well as the rapidity, how quickly this vaccine emerged, knowing that vaccines typically take years to develop. Are those fears and skepticism warranted? And what assurances can you give us tonight that this vaccine is safe?
No, I think that's an excellent question and a great place to start. Because let me just start by saying, one, it's okay. And I support you for having a bit of skepticism. I think that it's important to be skeptical. We were all skeptical, right? I think it's human nature to be skeptical. And to have questions or to be unsure. But I think the importance of being in that place and space then means, okay, if I'm not sure, let me go find out. So it's important to ask questions. It's important to get accurate information. It's important to go find the leaders in your community, people that you trust, who have shown themselves over time to be trusted sources of real, pertinent, true information. And I think for us tonight, we are, serving in that role for so many. And so I don't want to ever go out and say, if you're a bit skeptical, you don't have a right to be. I think it's smart to be skeptical, right? I think moving forward, though, watching and reading and doing our own individual research, we saw the trials, we saw the results of the trials in terms of the outcomes. We understand that with the 2 specific vaccinations that are available today here in the United States, both the Pfizer and the Moderna vaccination, that they are, 95%, if not more, effective. We know that they prevent mild symptoms as well as severe symptoms. And for me, the most important thing is death, right? We also know, and I think as African Americans, it's very important to understand that how this is different from specifically the Tuskegee Project, right? Because then that was done behind closed doors. That was done in secrecy. That was done without our input or frankly, our knowledge. But here with the COVID vaccination and this pandemic, when it came to the development, I mean, we have an African-American female researcher, Dr. Corbet, who's at the front lines of developing this vaccine for our country. You know, we have people who are sitting at the table at every level and even oversight who look like us. And that hasn't historically happened in history in terms of the things and the stories that we're fearful about or that have caused or led to, skepticism or fear. And for me, that helped to bring a significant amount of validation because that meant that people were speaking up for us. People were looking out for our community. They made sure that there were people who looked like us that were part of the trials to make sure that, it might work in this one group, but does it work for us? Does it cause a different type of side effect in our people, in our communities? And the answer was no to that. And I think so to go back to your question in terms of, where are we, in terms of moving forward? I mean, for me, I did a significant amount of research. And I know, way back in the early part of the pandemic, when we were talking about the fact that this vaccine was coming, people asked the question then, Dr. Steph, Bishop Walker, do you guys think that you're going to take the vaccine? And my answer was, I don't know. We'll have to see. We have to see for ourselves what the data shows. We have to see for ourselves, what the process has been. And in our opinion, it's been not just my opinion, but in the opinion of many experts around the country and our physician friends, et cetera, in higher places, the process was extremely thorough. Yes, it was rapid, but it was very thorough. And I think it's also important to understand that in terms of the mRNA type of vaccine that was created, it seemed like it just happened rapidly in a few months, but this mRNA type of vaccine, the mRNA type of material is something that they've been using and testing for over 10 years. So it's new to us, but it's not new to science. So this wasn't something that was just born overnight. So this is something they've been dealing with and preparing to use for such a time as this over many, many, many years. And again, the fact that there were people who looked like us that were intertwined into the entire process, looking out for our communities, making sure that that this stuff was not done in secret, speaks volumes in terms of the integrity of the process.
Dr. Lamar, if you could speak to some of the challenges that you have seen in terms of the distribution in underserved communities, even among those who are elderly, and some of the solutions that you've been able to bring to the table in terms of getting the vaccine to folks in an equitable fashion.
So a couple of challenges. For first, we fight daily the battle of misinformation. We're constantly making sure that we're seeking every opportunity to put out correct information, valid information, share the data, be transparent about the process. And so that's one barrier that we have been fighting. I agree with Dr. Walker is that coronaviruses have been around prior to COVID-19, and that the research has been done, and these viruses and these vaccines have been in development for some time now. And so as rapid as it seems, this is not new science, and we still have a lot to learn. And so I do want to preface that is that we don't know everything we need to know about the virus, about the vaccine, but we're learning as we move along. But it is designed to do exactly what it's meant to do, which is prevent hospitalizations and most importantly, deaths. Battles that we also fight is, a barrier to any individual, particularly our seniors, to getting this vaccine has been the ease by which they can schedule appointments. I think we've been doing a lot of work at the state to support the ease of making that happen. There's different systems that are happening in our rural counties, different systems and processes that are happening in our metros. And so we have to stay on top of those those different processes and make sure that we're educating individuals as to where to go to sign up, how to navigate these systems, where that information goes in terms of confirmations, and if you don't have internet or access to technology, making it easy so that we're relying on our community partners to help facilitate those registrations for particularly our seniors. We have partnered with hundreds of nonprofits, churches, academic institutions across the state of Tennessee, and really paying close attention to our metropolitan areas, Memphis, Shelby County, and Nashville and Davidson, where we have that higher number of minorities in those communities. Making sure that we're reaching those community partners, we're educating them, we're asking for support from them to help register folks. Our churches have been great, particularly in both Memphis and Nashville, with assisting us. We send lists, kind of a scheduling system, and I have a couple of slots that I've identified with our community health centers that have been gracious enough to provide us anywhere from 50 to 100 slots a day for our church congregational partners to be able to fit our seniors into those slots. They've been great at providing that access, so that where there are barriers with the county health department systems and they just can't figure out how to get that appointment, we have other partners in the community that can facilitate that. We have pharmacies, we have now Walmart and Kroger that are coming on, and so a lot more access than we had initially. And so that's our challenge. Again, making sure we're putting that information out, relying on our community health partners, and really just supporting each other to make that access more equitable and available.
Wow, thank you so much, Dr. Lamar. You've been incredibly busy. I see that is a pretty robust schedule and set of initiatives, and certainly we are all appreciative of that. Those efforts are necessary in order to make certain that distribution occurs among all populations, and thank you for that. Dr. Steph, I want to ask a question in terms of when a person gets the vaccination, what should or should not they expect to happen?
Yeah, and so it sounds like what you're asking about is, one, is it possible that this will make me sick? Is it safe? And what are the side effects? Okay, so in terms of the COVID vaccination, no, you cannot get COVID from the COVID-19 vaccination from Pfizer and Moderna or the Johnson & Johnson that's soon to be out. The Pfizer and the Moderna vaccination are made from mRNA, like I referenced earlier. mRNA is not the virus. You want to think of the mRNA like a roadmap or like a recipe. So you get an injection into your arm that's like a roadmap or like a blueprint or a recipe for a protein or a part of a protein that's on the virus. So it goes into your arm, your body cells are smart enough to read the recipe or read the blueprint, and actually it creates that part of the protein. And then your immune system says, hey, wait, that's not supposed to be here. We're going to grow an army of immune cells to fight this. And that's how this vaccination works. And in the process, it destroys the blueprint or destroys the recipe in the process. So you are not being injected with the actual virus. You are being injected with the blueprint to a particle or a protein rather, that looks like part of the virus. And so you cannot get COVID-19 from the vaccination. So that's another way that the vaccine has proven to be safe. That's one. Two, in terms of, potential side effects. So what happens, when you actually do get the shot? And again, Bishop, told you that he and I have gotten the vaccination. And one of the reasons why we wanted to go, before we had this conversation was so that we can say, okay, this is what happened. This is what you can expect. And to make sure that we put our bodies where our mouth is, as opposed to just saying, go get it without having experienced for ourselves. We want you to know that, yes, we encouraged and made sure that our parents who are elderly got the vaccination already, that we got the vaccination, and that when it's available for our children, they will get the vaccination as well. But of course, the vaccine is not available for children yet. And so in terms of side effects, so potential side effects that are, relatively common, 50% of the people apparently get side effects, and they tend to be very mild. So, you might get some, redness or swelling or soreness in your arm. We got that. You might get, some fatigue. You might get, headaches, or you might feel just kind of under the weather. We got a little bit of that. You might get sore muscles. You might feel like you might, have, muscle aches or fever or, or nausea or what have you. We didn't get any of those symptoms. Okay. And so what frequently will happen is that these symptoms will occur maybe, in the first 24 to 48 hours, up to 72 hours after you have the vaccination, but they're very short-lived. So for example, for both Bishop and I, we got the shots. Our arms by the evening of the shots, they were a little bit sore. And then by the next day, I woke up, I felt fine. But then when I started walking around, I was like, wow, I just really don't have a lot of energy. And that was the extent of my first shot. The second shot, I felt great afterwards. 24 hours, 48 hours, I felt great. 72 hours, I was like, you know what? I'm starting to get a little bit of headache and I don't have as much energy as I normally did. Let me go lay down. And by the next day, it was gone. And so again, very short-lived symptoms. And I would argue a very small price to pay, considering the other option if you actually do get COVID, right? So if you don't get your vaccinations, you are still at risk of getting the COVID virus from this, society and the environment. And so we've seen what happens to folks. We, at this point, with 500,000 people having died and over 24 or 25 million people being infected, we've all been touched by COVID in our lives. So we've heard what happens in terms of symptoms, in terms of people, and none of us are immune, right? And so a small price to pay to prevent from getting severe disease and being hospitalized or risking death, right? And so I would argue that, when it comes to the vaccination, I would do it all over again. And I am standing up and saying that I believe it is safe. I believe it is effective. I believe that if anyone who is listening, if you have not yet gotten your vaccination, when it's your turn, stand up, go get your vaccinations, get in line, sign up, and we'll be able to figure out, how to help you do just that.
Thank you. Thank you for that. Incredibly resourceful. I want to ask Dr. Lamar, are there instances where a person should not take the vaccine? For example, there's a lot of conversations and data floating around about if you have allergies or if you have, pre-existing certain conditions, and either one of you could address that. But I want to ask Dr. Lamar, would you say there are specific instances where you say, look, you don't qualify for this vaccine other than age?
So based on the data that we have, I have not heard much of anything relative to that. Now, there are a couple populations that we want to make sure and ensure that they're reaching out and receiving that guidance from their medical provider before they choose to take the vaccine. There has been information relative to previous exposure or previous allergies, severe allergies. And so that could be any allergy that resulted in the need for epinephrine, the EpiPen or anything like that. And so with that, there has been some reports of maybe some severe reaction to the vaccine. However, we've seen very little of that across the state of Tennessee, and I'm hearing very little of that happening across the country. And so nothing outside of that, but I would say pregnant women, those with severe illness and multiple chronic conditions, if there's a concern that you have, seek the advice and the guidance from your provider prior to getting that. But nothing that we are promoting say you don't qualify. Our decision or our model by which we offer the vaccine is solely based on an age risk model. We know that particularly in the state of Tennessee, more than 70% of the deaths in the state have been individuals 70 years and older. The hospitalizations, we're seeing the same. And so we created a model based on that risk. And that's why our priority has been, one, focusing on those on the front line that are the medical providers and those essential clinical workers, but also focusing on our seniors, making sure that those that are most at risk have first in for the vaccine. And so it's based on age. And then we're moving now, as we've addressed age, we're moving now into the comorbidities, those chronic conditions that have been those underlining risk factors for increasing risk for developing COVID and even dying of COVID. And so that's where we're headed. But age has been the primary risk factor that we've been able to create our plan around.
You know, one of the things that is coming forth even from some of our folks who are watching, and I think it's a very, very timely question. If a person, this is for either one of you, if a person has had COVID, do they need to take the vaccine?
Yes, I would say yes. I say that there should be no one. So unless your physician has really advised you against taking the vaccine, which that's valid, but no, I think everyone, even if you've had it, and depending on how recent you've had it, because there is a window of time that you want to make sure that if you say within a 90-day window and you've recently been diagnosed and had COVID, you may want to delay that a month or so before you take the vaccine. But if you've had it in the past, most definitely. Again, the vaccine is not, a miracle cure or anything like that. It is meant to reduce your symptoms if you are exposed again. We've seen individuals test positive over and over again. And so this will be a great option, particularly for those that have been tested positive, a great option to ensure that, for one, their symptoms are mild, and that, two, they don't develop any severity. Because, there is a risk of being more aggressive, particularly with these mutations and the variants that we're seeing. There is that potential. And so I would say yes. Especially those that have been exposed previously.
And I would like to just jump in there. And so one of the reasons as well, just to support everything that Dr. Lamar just stated, is when you get, when you yourself are, develop COVID from an infection, depending on whether your case is mild, moderate, severe, your body develops an immune response, and it's not always the same level of an immune response. So you might have mild case and develop a mild response, or a moderate case develop a moderate response, or severe case and develop a significant response. But there is no way for us to tell what your immune response has been to your infection, one. And then two, there's no way for us to tell exactly how long your those antibodies that your body has created will last you, if that makes sense. And so as a result, that's again why physicians and the medical community are saying, even though you have your innate immune response from your infection, you still need to go ahead and protect yourself and layer on this induced response from the vaccine, because we know what this vaccine is capable of doing, but we can't always guarantee that your immune response has mounted the type of immune response that will be protective for a longer period of time.
Let me ask this question. I think it's important as well. I know that Dr. Fauci has stated, I believe tomorrow is to give kind of an update on the CDC's recommendations of a post-vaccinated person's response back into the community, what they can and cannot do, or should or should not do. When a person is vaccinated, both vaccines, one, should they continue to wear a mask, and why? And what do you anticipate being, what do you anticipate being the lessening of restrictions of persons who've had the vaccine?
Well, so I would say yes, and most definitely yes. After vaccination, they should continue to wear the mask. Again, the vaccine is not meant to be a cure. It's meant to reduce the symptoms, reduce hospitalization, and reduce deaths. That means that this vaccine is not 100% able to prevent you from developing COVID. Again, having a 95% efficacy rate means that there's a 5% chance at some point that you could develop the virus again. And so to continue to do all the precautions, that means continue to wear your mask, continue to wash your hands, continue to maintain social distancing. I think until we have a significant proportion of the population vaccinated, you hear a lot about what they say, herd immunity. Until a certain proportion of our community, our population has been vaccinated, and we get to that point, I think the restrictions at that point may start to ease down, but we have a lot of work to do. We're still significant behind the 8 ball in getting particularly our minority communities, which is the priority community to be vaccinated, because we are at highest risk of severe outcomes relative to COVID. And so it's important that we significantly increase our minority uptake on this vaccine in order to achieve that. And so without us getting there, we're going to continue to move in the same direction that we're moving. And so if we're ever trying to get to a sense of normalcy, to ease these restrictions, we have to increase uptake.
You know, one of the things that, and I'll ask you, Dr. Steph, this, I think someone is asking, how long does the vaccine last? For example, will we have to be vaccinated every year? You know,
excellent question. The honest answer is because it's a relatively new vaccine and we're basically flying the plane as we're fixing it, we don't know. The medical community does not know, which is why they're continuing to study the individuals that have signed up for the vaccination trials. You know, there's a chance that, you know, we could be fully vaccinated forever. But then there's also a significant chance that just like the regular flu shot, you may need a booster shot every year. We don't know the answer, but like Dr. Lamar had mentioned earlier briefly about the fact that we know already that there are new variants that are arising from other countries from all over the world. So there's a chance that I think there's a greater chance that we will need booster shots with this, because if you're dealing with a virus that has the capacity to change, then more likely than not, you will have to make adjustments to the vaccine to make sure that people are covered over time.
Dr. Lamar, questions are coming in about CVS, Walmart, Walgreens. When do you anticipate the vaccines? They're asking for Davidson County, but I assume in most of the areas, when do you anticipate these vaccines hitting those pharmacies in those areas?
So they have already hit those areas. And so currently, all of our Walmarts, we have a little over 120 Walmarts, I believe, across the state that now have the vaccine. I know that in both Memphis and Nashville and our major metros, those vaccines are currently available in the Walmart pharmacy. Relative to Walgreens and CVS, a lot of the vaccine that has been allocated to those pharmacies has really gone to support our long-term care facilities. Those are our nursing homes, and to ensure both the residents and the staffing of our nursing homes, our senior centers have, nursing homes, all of that have been taken care of relative to first and second doses there. That will continue to expand as we move forward, and there's more allocation as they continue to finalize those populations and then expand that to the general community. What we have now is over the next few weeks, I think we have the Kroger stores across the state coming on to also provide the vaccine. And so again, creating multiple access points so that that challenge with just relying on just the health department to provide that access is eliminated. We have multiple points that we can connect.
Dr. Steph, someone's asking, is it okay for a person to take Tylenol or take some other pain, Advil, prior to taking the vaccine?
So I want to answer that question, but I also want to just comment on what Dr. Lamar just said, specifically because I know that we have people joining us from other states. And so what she was talking about is specifically what's happening here in the state of Tennessee. For you to know what's going on in your own state, I encourage you to reach out to your local, state health department. I also encourage you, with respect to the question about the pharmacies getting vaccines, you can go to their website. If you go to CVS or Walgreens or Walmart, if you go to their website, there's a banner at the top that says, click here to see which locations are already giving the vaccinations, and you can put in your zip code and it'll tell you all over the country where those locations are. Now, going back to your question, Bishop, do you mind repeating that?
Yeah, should a person take Advil or Tylenol prior to getting the vaccine?
So that's an excellent question. And the answer is no, but. So no, you should not be taking Tylenol or Advil or any pain medications prior to your vaccine, because what you don't want to do is blunt your body's ability to mount an immune response. However, after you get your vaccine, it is felt to be okay to go ahead and take, a little bit of pain medicine, either Tylenol, Motrin, Advil, in order to deal with the symptoms of the arm pain, if, low grade fevers, etc.
Okay, so we want to continue to take your questions. As you send those questions into the chat areas, know that our team is sending those questions to us, and we certainly appreciate some amazing questions that are coming forth. And we certainly will try to get to as many of them as we can. This is certainly informative. And, one of the, I think, $1 million questions is the question, and the president dealt with this, President Biden, who it's very refreshing to see COVID being a priority here, and address this issue around now you can expect a sense of normalcy around Christmas. All right. Now, I get it. I mean, great leaders, they oftentimes, under promise and over deliver. That's what great leaders do. I'm asking the two of you because people are ready. Like, getting this vaccine, get it, we start moving this. People are ready for some sense of normalcy. And even when you think about leaders like myself who have to reimagine re-engaging back into the physical location in church and etc. And guess what I'm asking is, maybe you can answer it this way. Bishop, you probably shouldn't expect church to open up again in a way that's safe, or our state or our football games and things that we normally do, larger events, no later than or no sooner than this date. I can't tell you when, but I can tell you this. Don't plan anything before this date. Maybe that'll help. Or maybe that's a bad way to ask it. But you understand what I'm asking. I'm just trying. And I don't want to push you in a corner, but I think people do want to kind of get a sense, like, are we talking Easter? Are we talking, which is April? Are we talking July? Are we talking the fall? What are we talking here?
That's a hard one. And I don't think we can put a date on it, but I think it all depends on, again, that uptake. We are currently, receiving, particularly with our Black and African American community, we're significantly low in terms of that uptake. I think nationwide, I think we're sitting a little above 6%, about 6.6% or something like that for the United States. That is significantly lower than the percent of cases that we saw in COVID. And so we have to at least achieve what those cases look like in terms of vaccine uptake for our minority communities before we can even try to pinpoint a timeline around re-engagement in the manner that we once were, engaged in. I think too, some things may change for the good and permanently, and some things that have proven to work well. I mean, we have, just taking the Department of Health, for instance, we were all kind of prior to COVID, all in the big, tall building, right? 1,000 of us, engaging a day, but we found that we can be very efficient working from home and operating differently than we did before. And so some things we look forward to re-engaging and getting back, going back to church is one. And I think, but some things have proven maybe it'll sustain that change after COVID. But I think, again, it's all about the uptake. The more vaccines we can get in arms, particularly in our African American communities and our Hispanic communities as well, because of that risk, then we can put a date on it and put a timeline on that.
Okay.
I couldn't agree more, but let me just jump in and say this, because I agree with Dr. Lamar 100%. What I don't want to happen is, as people get vaccinated all over the country, people look at the TV and they look at numbers and they hear people say, wow, the number of people that are being infected is going down and the number of people that are being hospitalized are going down. When your numbers are way up here and they should be way down here, and they're saying they're going down, that means that they're here. It does not mean that we are where we need to be. We've had over 25 million people infected in this country with this virus. We've had over 500,000 people who have died. Even just today, even though we're doing better because at least 64 million people have already been vaccinated, but we're heading in the right direction, we still had 22,000 new cases of COVID, and that was this afternoon. So that number is higher. We still had 1,000 deaths from COVID, and there's a vaccination available. Imagine that. Yeah. How tragic would that be to have a vaccination available that can prevent you from having severe illness, being hospitalized, and dying, and we not take it, and then us end up getting COVID next week. So I really want that to sink in, because that's sort of the crux of this. People are getting vaccinated. The vaccine is available. What can we do to make sure that our families and our loved ones and the people that we know and love and touch every day are informed and comfortable and have their questions answered so they feel comfortable raising their hand and filling out the registration form to go down and get their vaccine, to prevent them from becoming a statistic? I think that is so critically important. And like Dr. Lamar said, in terms of, her office is responsible for, the equitable distribution of the vaccine. They can send the vaccine, but they can't make our communities take it, right? And so it's up to us to make sure that we go get the vaccine that is being offered, because as a community, that's been the hardest hit in terms of, of infection rates, and been the hardest hit in terms of deaths. As African Americans and also as Hispanic populations, we have 3 times the risk of being infected. We have 2 times the risk of dying from COVID compared to our white counterparts. And so that means that we should be the first in line, because we are the worst impacted by this virus. And it's so critically important that we understand that as a community.
One question, Dr. Steph, someone asked, and if you take immune medications, will it interfere with the shot or vice versa?
I think that's an excellent question. And I think it depends on what immune medication you're taking. So if you are on immune modulating medications, that's a conversation you should have with your physician. They might tell you everything is fine, don't worry about it, keep taking it and go get your vaccine. Or they might say, you know what, I want you to hold off on this medication for a few days, go get your vaccine and restart it afterwards. So again, that's a conversation that you definitely want to have with your physician. It's an excellent, excellent, excellent question.
Someone asked Dr. Lamar, the Shelby County having to throw out approximately 1,300 vaccines. And they want to know why did they go unused?
So I'm kind of, proceed with a little caution here. It's multifaceted. I think. I don't know. I want to kind of reserve my answer. I think there's a number of reasons there. Some relative to oversight, some weather related, and of course, last week we were hit very hard with the snow and ice, and the ability to get that number of vaccines out into the community has been a barrier. So if I'm allotting, any county or any entity a significant number, and that number is based on how much they feel they can get out within a week or 2 weeks. And so when the weather hit, you are already stocked for a number of weeks with that amount of vaccine, and then you weren't able to get it out. So that's one of the reasons. But it's multifaceted. It's a lot going on in Shelby County.
Sure.
But what we've been able to do, again, is we've created partnerships. And so other entities, again, within that county have been allocated vaccines. So even without that volume at the health department, we have multiple access points that we could navigate individuals to. And so all of that information, they can reach out to me, and I can help facilitate some of those connections.
Sure. And to that point, let me say, one of the things that I am incredibly passionate about is Mount Zion continuing to be an oasis of hope in the Nashville community and the world. And recognizing that we are the largest African American church in the Southeast region of the United States, and recognizing that we have this unique position in terms of locations, facilities, etc., and that we're in the virtual space and we have these facilities that we can use to partner with agencies and etc. And I want to talk to Dr. Stell first and let you chime in. I want to go on record as a pastor and say, and you're hearing it here first, that Mount Zion is incredibly committed to partnering with agencies and partners that you all have in providing vaccination sites that allow our people to be vaccinated. Members of our church, members of other churches, members of our community, etc., because we have the facilities and etc. And so I want you to know that publicly, that as a pastor, I want to make certain that I bring that to a place of awareness and visibility, so that you will know and not have to second guess that, because I do understand how partnerships are very critical in the equitable distribution of the vaccine. Dr. Steph, you can speak to that in another.
Yes, and I echo that sentiment 100%. And we are actively, as Mount Zion, in conversations with the Tennessee Department of Health, along with other community partners, to become a site. Of course, there's logistics and things and conversations that need to be had, but I want our congregation to rest assured that we are inserting ourselves into these conversations to make sure that we are taking care of our congregants and the people that we shepherd, for sure, because we understand, like part of the conversation earlier, that it can be difficult to find a location to get your shot. It can be cumbersome to possibly go online and try to figure out how to sign up for a shot. So our goal is to sort of remove those barriers, and I know that Dr. Lamar and her office are committed to making that happen, in terms of helping to remove those barriers for populations such as ours. And so, yes, we are in active conversations regarding that.
Yes, most definitely, and we are definitely moving in that direction. We have, I believe, some information that will come out soon relative to that partnership. We have a variety of community partners, our FQHCs, our community faith-based clinics, that are all engaged to make sure that we're providing that vaccine. Particularly, what Mount Zion's Antioch location offers a lot is that the fact that it's on a major transportation line, having that accessibility for individuals who do not have vehicles. If you notice, many of the other sites, particularly those large health department sites, you see lines and lines of cars, looping around the community. What we want is to be able to provide that equity around every bit of the access barriers. And so that is making sure that you can walk to a site and that you don't need a car, that we're indoors and we have a plan to be indoors and not in the elements. And so a lot of barriers we're trying to eliminate as we move forward and as we continue to progress on the discussions for that. But we have a variety of engaged partners that are ready and willing to move that forward. And I do want to open up to any faith community that may be tuning into this conversation, is that if you have a congregation, particularly with seniors who have had challenges with receiving access, I just recommend reach out to me, reach out to my office. We have partners that have identified some opportunities to fit them into some slides for appointments for that vaccine. And so don't give up just because you can't get into that health department site. We have other options.
So I want to, as we prepare to wrap this up, and this has been just a tremendous conversation, and what amazing questions, and we welcome those challenging questions and those questions that you've raised. They mean everything to us, and that's why we did this, and the conversation will be ongoing. I want to give our presenters 1 minute, 60 seconds to do this. One is, Dr. Lamar, you first. I want you to, just from the heart, from the head, both, why now, and why it's so important for our people to take the vaccine, And after that 1 minute, if you could also let people know how they could actually contact the proper information to contact if they have questions, et cetera, to your office or your assistants. And then, of course, Dr. Steph say 1 minute, passionately why. Why does it matter to you? And then we all have our personal stories where you've seen so much. And then, of course, give information to folks on how they can contact you as well. Dr. Lamar.
So thank you for that. So of course, COVID has been devastating to this country, but it's been very devastating to our communities of color. In terms, not just, we talked a lot today about the health of our physical health, but we have to think too about the stress that is played on many of our lives. It has impacted our communities both socially as well as economically. And so a lot above just health has been has plagued our communities, and so it's important that we recognize that, and we recognize the fact that we have lost income and housing and all types of things that have meant so much to us. And so it's important that I get the vaccine, you get the vaccine to protect. I'm protecting myself, I'm protecting my family and my children. I want my children in school. I'm glad today that they were able to get there. And so that's exciting. Our children are being impacted. It's important that I think about my communities and those around me, and I get vaccinated so that I protect myself, my family, my community. That's the only way we're going to get to a sense of normalcy. Any information, more information about COVID-19, our response, our plan is available in multiple languages and multiple formats on our website. That's covid19.tn.gov. And also, you can reach out to my office. That's the office of the Tennessee Office of Health Disparities Elimination and our Office of Minority Health. Much information is available on our website, and please feel free to reach out to us at any time with any comments, needs, and need for us to continue to connect you to information and to services.
And I would say, the why for me in this moment is because our community has been so hard hit. It's not just, these aren't strangers. These are people that we know, that we love, that we, used to sit next to, walk next to, talk to. These are, first responders. These are colleagues. These are physicians. These are, nurses. These are, people who are helpers in the hospital. These are grocery store workers. These are people who are delivering our mail. These are police officers, people who work for the fire department. These are, sisters, cousins, uncles. These are, leaders in our community who are getting sick and dying. And in my opinion, dying unnecessarily because of, the rampant nature by which this disease took over our country. And here we are, 2 weeks from the anniversary of, pretty much everything shutting down and our lives changing forever. And the reality is, like Bishop mentioned earlier, I thought I was in for a sprint, maybe 3 weeks, 3 months at the most. And here we are almost a year later, still running this now marathon. And we know that we can get out of this. We can see the light at the end of the tunnel, but we need people to do what they can do to be part of the solution. And to become part of the solution, we need you to get your vaccination, because the sooner you get your vaccination, the sooner we can do what Dr. Lamar was referring to earlier in terms of, opening up, getting to that herd immunity, which just basically means 70 to 85% of the population are vaccinated, so that we can be safer, so that we can move forward, so we can get back to some sense of normalcy. But again, there will be no normal in terms of the way that we want to do things. Things will be changed forever. But I want to be able to send my children to school. I want to be able for my children to go visit their grandparents, for them to have play dates and birthday parties, and us to be able to get out and go visit friends and have dinner, like the basic things. We want to be able to do that, but we can't until we get to a place of safety for not just ourselves and our respective families, but for our entire country, our community, our entire country. And so that's why we're here. That's why we're having this conversation, because it's so critically important. There's no I in the word team. It's going to take all of us to work together to get to the other side?
It was 32,417. That was the number on the right side of the television at the very moment the man who blessed me, baptized me, the only pastor I've ever known, succumbed to COVID-19. 85 years old, but he was in relatively good health, looking forward to his retirement, doing what he normally would do, supporting someone else, unbeknownst to him, at a church service. And he caught COVID, and people around him caught COVID. And from that number, 32,417, there has not been 1 week that my phone has not rung or I've received text messages no less than 3 times a week since that date. A pastor, a bishop, a friend who was either contracted COVID or died from COVID-19. As a pastor, I am exhausted. I am angry at those who are cavalier about this particular disease. COVID is real. It is not up for debate for me. I care about you. I care about our community. And I, like you, want to get back to church. I want to see you. I want to run across the church like we used to and have good old worship and run between those locations and high five you. And I don't know what that will look like. I don't know what our new normal will look like. I don't know if they'll shrink wrap me and put me in a bubble and tell me just to wave at people. I don't know. I say that humorously, but there will be some redaction in how we interact. But I do want you to know this as your leader. I am continuously committed to following the science. I believe that God did something providential, that God connected me with this amazing woman who spoke to me, who spoke and ministered to me in March of 2020 and put a demand upon my faith as a leader to say, you need to shut down now. And had Mount Zion, with its demographic and the volume of people that we minister to, had not shut down in March of 2020, Mount Zion would have contributed to many, many more cases of coronavirus, simply because of the tentacles that we reach in the city. So I am committed to following the science, and I'm a man of faith. And I want you to know that we love you and we want to see you live. We want to see what Jesus said in John 10:10, the thief does come to steal, kill, and destroy, but I have come that you may have life and life more abundantly. That's a quality of life. And we will have that again. And that day when I see you again, when we come together, I want to be able to declare, now that you have received this information, now that you understand the importance of vaccination, you go and talk to your physicians, you go and pray and you do the research, but you've heard it from these extraordinary experts tonight, and you've heard it from the heart of your leader. My prayer for you remains Numbers 31 and 49. The Lord, I have counted those under my command. And Lord, I want to be able to say, and not one of them will be missing. Thank you for tuning in tonight. Facebook, thank you for tuning in on YouTube. Share this with as many people as you can. This is the kind of information that needs to go viral for all of our churches, all of our community. If you have any questions, reach out to us. You can reach out to me on Instagram, Joseph Walker 3. I will connect you with the right folks. We just want you to live. Thank you, Dr. Lamar. Thank you, Dr. Walker. Thank all of you for tuning in. May God bless you. And that's our prayer. Have a good night.